Welcome everyone to the Ontology Summit 2022. The summit theme is pandemics and other disasters. Today is January 26, 2022. And this is the first session of the first track, which will be dealing with general disaster parameters. And Ravi Sharma will now take over to chair the session. Ravi?
Yes, thank you, Ken, and thank you everyone who has come to participate. It is a very exciting set of topics, pandemics and other disasters. It is the second session. In the first session, we have introduced various tracks. There are 4 tracks and 1 general track, overview track. And today we are very happy to see our session 2. That means almost the first few speakers and a panel who will discuss a combination of how we can use technologies to do
fewer people.
Pandemics as well as Earth observations. So I will hand over to my co-chair for this track, Gary Burcross, who will now introduce the speakers and the panel, and the speakers will then begin. Thank you.
Thank you, Ravi. This is Gary Birdcross. So first I should say that we had planned to have as our first speaker, really Stephen Ambrose from the University of Santa Barbara, University of California, Santa Barbara, who has a very nice overview on disasters using and leveraging UN vocabulary on disaster relief and recovery and how to build ontologies, semantic products in there. Unfortunately, Shirley was asked to present at an NSF meeting. It put on the agenda, and of course she's on that grant, NSF, and therefore she couldn't make this particular meeting. But luckily, we were able to have a very good panel that was able to come today and talk about this topic. I'll introduce 2 people, starting with Josh Lieberman, who will be our first speaker and is a visiting senior research scientist at Harvard Center for Geographic Analysis, or CGA. Josh serves as a coordinating architect and initiative manager for the Open Geospatial Consortium, OGC, which you'll hear more about today, and as a lecturer at the University of Maryland, Baltimore County. Josh has, in terms of background, Josh has a PhD from the University of Washington and an MS from the University of Oregon, a West Coast guy, but also an AB from Dartmouth College, so he has the East Coast represented here too. Josh has notable experience in earth and environmental sciences and geospatial modeling, and has presented on those topics at the Ontology Summit before. Our second panelist member will be Paul Churchyard, who's at HSR Health, and his specialty topic today will be on spatial data infrastructure. Paul is a Chief Geographic Information Systems Engineer at HSR, which stands for Health Solutions Research Incorporated. Paul has an MS from the University of Baltimore, Maryland, Baltimore County in Geographic Information and Cartography. With that, let me turn it over to Josh, who will start and give us an overview of OGC and things of that nature.
Thanks very much, Gary, and hello to those who I've worked with here before, and hello to new people as well. Thank you very much for inviting me to say a few words here, and very pleased also to basically set the table for Paul, whom I've very much enjoyed working with in this disaster pilot. But I am imagining that some of you are not completely familiar with OGC, although I doubt any of you think that I'm referring to the Office of General Counsel. It stands for the Open Geospatial Consortium. And the part that maybe is most well known or most venerable is the standards program. So OGC develops and publishes global standards for the modeling, the exchange of geospatial information through modern web technologies that we can get our hands on. And so many of those standards, the web map service, the geographic markup language, and other things that are maybe closer to the Ontolog Forum's heart, such as Geosparkle, have been published and are in use all over the world. But there's this other part to OGC, which is how we get to the ideas for standards and really, test how useful the standard might be when you can't even do the things that it enables without the standard. So that's sort of pre-sales engineering. And then what can you do with the standard once it's developed? How can its value and rate of adoption be improved? And that's the post-sales engineering. So what I'm going to refer to is an activity which is really kind of post-sales, although somehow we always get into something that's a bit bleeding edge when we dive into this. Anyway, you see a slide that was put together by Dr. Ingo Simonis describing some of the topics that the innovation program activities have been involved in, and that go, in this problem solving area. Test beds in particular will take technological challenges like what is a geodata cube and what can we do with it? Or how do we support and sustain machine learning models? And also a number of linked data topics always come up. Now we've just finishing up at least a phase of a activity we've called Disaster Pilot 2021. And there's a long history of activities in OGC related to disasters. They are, a problem, an increasing problem. They concern people and societal goals, but most of all, how effectively we deal with them at any stage is really affected by how much we know and how we can stay informed. And that rapid and effective sharing of information is critical. And that's where OGC has often been able to come in and help matters. So I'm going to go through a couple of these others to get to this pilot. So this pilot was sponsored by the USGS, by Natural Resources Canada, by NASA. It was supported by Amazon Web Services, by NOAA, by Maxar, by the Peruvian Space Agency, CONIDA. And this is really the goal of this particular pilot was to get these interesting data sets, particularly Earth observation data sets, space-based imagery and so on, and see how much better we can do at getting that information in actionable form to people on the ground through a paradigm we're calling analysis-ready data to decision-ready indicators. And I won't go into that a great deal, but it's that collaborative but agile value chain of various diverse information to actionable indicators that really this focused on, this reducing the 80% of data wrangling and misinformation and miscommunication. So there's one other thing that Paul will not talk about. I will just touch on it, but there is a linked data aspect to this pilot as well. And that's specifically trying to add structured data, which is in the form of JSON LD, to headers of web pages with current, so vital current information about localities and disaster situations, so that that information can be surfaced immediately in web searches. And there's actually a range 14 component to that. We worked with GS1 and their global location numbers to precisely identify facilities that people are looking for information about. So for example, someone is publishing information, maybe HSR, about availability of beds in a hospital. There is a global location number for that hospital, and that web page which says this is how many beds there are and this is where it is, also is referenced by the GS1 resolver, which says for this facility, here is a web page with additional information. If everything works properly through schema.org and various forms of magic, a web search request, are there open hospital beds near me, directly results in the unique identity of this hospital and the number of beds right in your search results. So it's not reasoning, but we hope it'll be reasonable. So let me go on and just say that there were 3 scenarios that we had attacked in this pilot, and all 3 of them include the health data related to pandemic response. And in fact, the 3rd one just focuses on some previous information about what would we include if we had such a thing as a health spatial data infrastructure, and how does that fit with the data which is actually being made available. We've included the pandemic impacts and the health information in the 2 other scenarios as well, because this problem of disasters is a real challenge these days, but the problem of cascading and complicated, of overlapping and reinforcing, inter-reinforcing disasters is increasingly a problem. So I'll turn things on to Paul to talk about specifically the health
Josh,
information.
Before you do that,
here. Yeah.
Josh, before you do that, could you go back 1 slide? Seems like you had the life cycle of disasters on a slide there. And I think that's the one. Disaster
Okay.
cycles and indicators. It's just nice for us to look at this for just a minute as the part of the landscape of what is taken into account.
So this is a cycle within a cycle. So the larger emergency management cycle, and within that, the cycle of response to individual incidents. And we've always indicated these as cycles because one needs to remain ready, but increasingly one disaster blends into another. The mitigation of the effects of the last disaster roll into mitigation of the effects of the next one, combined with resilience. So out of these, which many of these we'd love to work on the information sharing to improve, we've focused in the pilot on 6 fast moving needs, places where you need to move fast, be specific, support specific areas, specific hazards and impacts, and the people who respond to them. So the risk and vulnerability, the threat prediction, the detection and severity evaluation, the impact and evaluation, and the response and mitigation activities. So all of those things that require fast action often, involve changing your plan, right? So it needs people saying, I need this, and other people saying, well, I can provide you that. How can we meet in the middle? So that's really the import of this particular slide.
Great, thank you, Josh.
So I'm happy to turn it over to Paul and answer any questions that people might have. Probably easiest if it's in the chat here, but I'll stay on. And the other thing is, let me go to that, ogc.org, news and events, latest news. Let me put it in here. Okay. 2 things. Innovation program, webinars. Oh, come on, it was in here. Okay. About the innovation program. They should have this in here. Why did we put it in here? Okay, anyway, there is in here, I probably find it easier with Google, information about the demo event that we had yesterday and recordings which will be available from that in the future. And the other thing that might be of some interest is readiness.disasters@ogc.org. So some of the outputs from this have been two guides for readiness to engage in this sharing of information during, before, and after disasters. And there's actually two guides, one focusing on providers of information, and the other focused on users. And these are going to be live documents. So there's places to provide feedback and commentary and review on these, and we'll continue to update these guides on a reasonably regular schedule so that they can be as useful as possible for those involved in this activities, which if you're a user is everybody, really. So that's it.
When you have time, if you can put a link into those, one or more of those, that would be great.
Yep.
Be nice to have a set of your slides, Josh.
Yeah, so they'll be available through the event website, because these are from that event. So I will let everybody know when that's available.
Cool. Thank you very much, Josh.
Including a couple of them that you presented.
Yeah.
Thank you.
Okay. Thank you very much for lending me your time to discuss the work that we have done so far during the disasters pilot for the Open Geospatial Consortium. As discussed earlier, I am Paul Churchyard, the Chief Geospatial Engineer for HSR.Health. HSR.Health is a geospatial health risk analytics company that provides insights on the relationship between social determinants of health and health outcomes and costs. We have leveraged these insights to produce health analytics surrounding the COVID-19 pandemic globally, including in the US and Africa. Today, I have the pleasure to demo for you the health risk analytics we've produced to help emergency response personnel and public health decision makers understand and respond to current and future health risks, especially including natural disasters and pandemics. Much of what I'm going to demo played a role in the disasters pilot, as Josh mentioned earlier. Our COVID-19 pandemic work was built off of our participation in a previous OGC disasters resilience pilot from 2019, where we built, with support from FEMA and other federal agencies, a health risk index that provided a priori information on the underlying health posture of disaster impacted populations. FEMA and their peers can use this information to plan for and allocate health resources as necessary to meet the health needs of the disaster impacted population. In today's demo, I will discuss our health spatial data infrastructure and its health data model, our application of our medical supply needs index for the COVID-19 pandemic in Peru and in Louisiana, and finally, we'll discuss our additional work and plans for the expansion of our current work. This analysis involves the integration of various datasets and analytics to produce indicators that can be accessed and utilized to aid in disaster response. To support these efforts, we have built a spatial data infrastructure that allows for the upload, sharing, and downloading of data and indicators in a findable, accessible, interoperable, and reusable way. Our health SDI was made available to the other pilot participants and used to upload, store, and analyze data. The hosted data was also made available through web map services and is publicly available through a subscription service. In addition to building a health spatial data infrastructure, HSR.health also expanded upon the existing health data model and identified the mismatch between ideal and currently available data. The three main areas of data and indicators that HSR.health expanded upon include essential foundation data and technology data, which includes base layers such as road networks and hospital locations, indicators for disasters, such as identifying individuals with electricity-dependent medical devices or care, as well as with infected water supplies, and health indicators for pandemics, including information such as case counts, death, mortality risk, and vaccination rate. In order to ascertain local health issues, the census tract level of geography is the ideal granularity. The state of Louisiana made this pandemic-related information, including case counts and deaths, available at the census tract level, which is one of the reasons why it was chosen for the US scenario in this disasters pilot. Numerous states do not make pandemic data available publicly down to the census tract or even zip code level. Data at the county or state levels can still be helpful, but it limits the ability to perform local level analyses of health issues. Establishing a centralized repository for health-related data will help enable increased visibility of up-to-date health conditions and speed the pandemic response and global public health decision-making overall. For the Peru pandemic and flooding scenario, I will demonstrate our medical supply needs index and how it has been applied to the Rimac River Basin in Peru, and describe the interaction between the pandemic and a coincident flood scenario. One of the components of our medical supply needs index is the pandemic risk index, which is comprised of both our mortality and transmission risk indices. The mortality risk index utilizes data on population demographics and the prevalence of comorbidities to identify the risk to the underlying population of severe illness, hospitalization, or mortality due to the COVID-19 pandemic. Health and policy decision makers can utilize the mortality risk index to identify areas where they want to minimize the spread of pandemic due to concentrations of at-risk populations. The transmission risk index utilizes data on population, case counts, area, and human mobility to identify the spread of COVID-19 by geographic area. The pandemic risk index combines these two indices to represent both the spread of the pandemic and the health risks that the pandemic poses. The mortality, transmission, and pandemic risk indices are normalized to fall between 0 and 100. Current generalized recommendations from those indices is that 0 to 25 is low risk, 25 to 75 is moderate risk, and 75 to 100 is high risk. The pandemic risk index can be used by health and policy decision makers to gain a complete picture of the risk that the pandemic poses from both the spread and the vulnerable populations. One way this could be utilized is through narrowing where lockdowns occur to only places with both high spread and highly vulnerable populations. The Medical Supply Needs Index produces 3 levels of need: high, low, and index-based levels of need. The high and low levels of medical supply needs, highlighted here in these red dashed boxes, are based off of hospitalizations, supply utilization by type, in this case, personal protective equipment such as gowns, gloves, and masks, the number of healthcare workers, and the number of first responders. Once the high and low estimates are calculated, the pandemic risk index is incorporated to reduce the supply level based upon the spread of the pandemic and the risk to the underlying population. The Medical Supply Needs Index is used to determine when and how much supply needs to be delivered to each hospital and clinic. With a coincident natural disaster, the Medical Supply Needs Index calculation can be adjusted based upon increased volume of patients due to the disaster and based upon a shift in load on medical systems if a hospital or clinic becomes inaccessible due to a natural disaster. As a part of this pilot, and as Josh briefly mentioned earlier, we worked with GS1 to utilize their global location numbers in order to aid in supply chain management and documentation so that decision makers can keep track of where their supplies are going. This slide shows the Medical Supply Needs Index and hospital and clinic locations for an area of the Rimac River Basin surrounding an area of flooding that occurred on the 15th of March for 2017. We worked with Skymantics, a fellow participant in the pilot, who built a routing API that could be utilized to move supplies from distribution centers to the hospitals and clinics. In this example, we are supplying the local clinics from a nearby railway station. The purple lines shown here show the fastest supply routes to the two clinics without any flooding. This blue area shows the flood extent, and we can easily see that 3 routes are affected by the flooding. One can easily be rerouted with minimal impact, but routes to the supply clinics 1 and 2 need very long detours to keep them operational. In this case, a better solution is to direct new patients to nearby clinics 3 and 4, which can be resupplied easily with relatively short routes from the railway station. From the table on the right, you can see how the medical supply needs shifted due to hospitals 1 and 2 being inaccessible due to the flooding. This analysis allows healthcare practitioners and decision makers to understand the situation and needs on the ground so that supplies and staff can be allocated properly to address the current situation and supply needs. The US scenario for the 2021 disasters pilot, as Josh mentioned earlier, focused on a pandemic health use case for the United States. New Orleans, Louisiana was chosen as the area of study as Louisiana has census tract level of pandemic data, as mentioned earlier, and is an important use case to build off of in future pilots due to the frequency of coincident natural disasters that happen there. For the US scenario, we replicated the medical supply needs index at the census tract level for Louisiana. This slide shows the medical supply needs index with hospital locations marked here in these red icons, as well as supply locations as these green stars. Finally, I'd like to discuss 2 applications of Earth observation data for health and pandemic use cases. In a disaster scenario, specifically flooding, imagery can be utilized to identify where potential contamination of drinking water has occurred, which can cause an outbreak of illness and disease. Earth observation data can also be used in a pandemic context to identify the intersection between urban areas and wildlife habitats, as these areas can be flashpoints for zoonotic spillover events and can cause a new pandemic. Louisiana, for example, could experience zoonotic spillover events given its potential for flooding and the proximity of urban areas to wildlife habitats that may become flooded. Based in part on our work addressing the pandemic and with feedback and input from the USGS and FGDC, we have built a model to assess, track, and respond to the impact on human health from climate change and zoonotic spillover. Peru as well may make an ideal location to test a zoonosis and climate change model, given its tropical climate, deforestation, and urbanization, which can lead to an increased potential for human and wild animal interaction. Additionally, Peru has historical health data, public health surveillance, and can potentially extract zoonosis and climate-related data from its EO data resources. We have been able to integrate our health risks models with flood and landslide information and want to expand it to other natural disasters as well, such as wildfires. Additionally, we look forward to continuing and expanding these efforts related to the pandemic and health emergency response, such as expanding the analysis involving pandemic and coincident natural disasters, a further expansion of the health spatial data infrastructure, exploring more Earth observation use cases relating to health and pandemics, deploying our climate change and zoonotic spillover impact on human health model, and we welcome the opportunity to collaborate on advancing and implementing any of these models going forward. Thank you very much for your time.
Excellent, excellent.
Thank you very much, Paul. I
Thank
guess we
you.
now have a chance for some questions and answers. There are really 2 Zooms here. One is on the, 2 chats here. One is on the Zoom and there's another one that some people have logged onto that also have some questions. So with that, let's throw it open for discussion.
I see one about inventory management systems. We didn't really incorporate that into this specific pilot effort. We were just utilizing publicly available data on the availability of current supplies, as well as utilizing our analysis for identifying supply needs, as getting that kind of real-time data was a bit out of scope, if I remember correctly, for the pilot, Josh.
Yeah, so as continues, the access to data, but particularly the collection of data when it's really needed, is still a work in progress. So we chose, historical intervals where there was occurrence of disaster and availability of data, so that we could at least test the what if.
So I have a question about the data. 2 years ago, we had a session on knowledge graphs. And I'm just wondering what your opinions might be for using a knowledge graph approach for any of what we've heard here, or maybe in the future.
I think that a lot of the information that we're trying to pull together is well represented by a knowledge graph, but the difficulties extend from the ability to maintain those connections to applications that actually make use of them. And I don't know, there was a big kind of a blow up discussion, I forget where, about Ordnance Survey dropping its linked data support, and nobody uses it, and so on and so forth. And this has come up a number of times when we've tried to say, this knowledge is represented by links between entities, and a lot of the insight comes in the form of those links. But try to find an application that people are familiar with that really makes use of that besides a browser, and I think you're still in trouble. So we've not focused on that, except in this case where there is an application which is called web search that does benefit from increased data linking. But again, that still raises the question, how do those links, the resolution, for example, of global location numbers to pages that contain information about that facility. And remember, that's using the 303 additional information can be found here. That still suffers from fragility, I think, in terms of whether those links are reliable.
So Josh, following on this Gary's question, how often do you scrap or revisit the broken links to keep some kind of synchronization between spread of pandemic or spread of disaster effects versus linked data?
Yeah, so that's a good point. We didn't examine the sustainability directly, but in terms of being able to determine the time criticality, for example, that's often in hours, which means that the validity of links such as localities to resource availability need to be maintained on at least an hourly time scale. Paul, you probably have some comments about that as well.
Yeah, so a lot of the at least publicly available data that we've been using to monitor and track the spread of the pandemic has been from stuff like the Johns Hopkins COVID repository, as well as utilizing data from, I believe it's COVID Act now. We were earlier using the COVID tracking project. So that stuff is updated daily. And at least from a pandemic perspective, once you're actually in the thick of the pandemic, it's not the very early stages where you really want to do contact tracing. Daily analyses are, for lack of a better term, good enough on a temporal time scale so you have a good idea of how many people are infected in an area. But when you're starting to combine it with disasters and how a storm path or how flooding is expanding, then yes, you do really need that hourly data so you know exactly where you want to get people out to make sure that people are safe and you can get them out of the way of a disaster. Definitely.
The time scale of disaster, it can vary. For example, floods take a day or two to reach peak in rivers and in flooded areas. Some are somewhat predictable. The pandemic spreads at its own pace. For Delta, it is small rate of spread. For Omicron, you will find it's larger, faster spread. So marrying these two dynamic situations is a challenge. What's the biggest challenge you are facing?
Well, I think you should mention that assuming that floods are predictable is a dangerous miscalculation, as people in Western Germany discovered. There's flooding which is from the rise of rivers, and there's flooding from channelization of overland flow. And in that case, actually the transportation network became the river network. And so there was rising flood water. And the videos are really astounding. You know, within minutes of the overland flow reaching a certain level. So we liked to think, and there are cases where, you know, there's a case in Australia where they knew the flooding was a month away, right? Couldn't do anything about it, but knew about it. But it's not always the case. And, you know, Paul, you can elaborate a bit, you know, with regard to the pandemic. Yes, we might have seen Omicron coming, but, you know, it turns out when we saw it coming, it was already here. So how to deal with that?
Yeah, so from a health and pandemic standpoint, there's kind of two main challenges. One is with any type of infectious disease, it's almost impossible to get the actual real-time spread of the infection because you have incubation periods. People don't get tested every single, well, sometimes they do, but people don't get tested every single time they go outside. Those test results take time. So you're always lagging behind the infection. So that is hard to do that actual real-time implementation. So you're always lagging behind. And as we kind of saw with, well, as we've been seeing with COVID, another big limitation, especially when trying to combine it with other disasters, is the availability of spatially granular data sets. Louisiana was a great case because they did produce the results of case counts by census tract, which is very granular data, but quite a lot of states, it was only available at the county level. And it's not necessarily helpful in trying to determine what proportion of the population you're trying to evacuate might be highly infectious, because when you have shelters and stuff like that, you have lots of people crowding together, and you don't want to take highly infectious populations and put them in with people who aren't sick already, because you're just going to increase the spread of the pandemic. So that's, I think, one of the two kind of major challenges when it comes to health and pandemic related data.
So I would add on this predictability of certain things that we're being somewhat humbled, but we note that science is dynamic. And so things like 100-year floods, which were based on historical records, that don't apply linearly as they did in the past, because some of the assumptions of that are different, and we have to sort of revise some of these models going forward. And it's often useful to play various scenarios. So you have a range of possibilities, and sometimes varying some of the parameters, because that's one of the concepts we have in this landscape here. Varying some of the parameters can produce some really surprising results because of the dynamic interactions of certain things.
Yeah, I'll have to put in a pitch, Gary, for the pair of pilots that we're trying to set up this year. So we're going to do another disaster pilot episode, go deeper and also cover, in particular, more climate-related hazards, some of which are the same hazards. But we're also running a climate services pilot. So there's a lot of climate research. There's a lot of information about how the changing climate affects those historical probabilities, but there's not a lot of access to that information. So the pilot is going to try to work with OGC standards to make that information about how things are changing more accessible, so that we can run some of that information into the disaster pilot and say, yeah, I know this was a 100-year flood, but the changes in these areas indicate this is going to happen every 2 years. So expand what you have to imagine and prepare for.
Thank you for that update. It does remind me that we do have a track on environmental disasters, especially, and one of the topics at the end of that is on climate, and we are thinking about having a panel. We have some people who might participate already, but you might be able to, you and Paul might be able to suggest somebody also who might serve on a panel on climate.
Yeah, definitely. Because one of the, as I kind of mentioned, one of the other things we're looking to do is see the relationship between not only just climate change and zoonosis, as a lot of times you get stuff like vector-borne diseases cause pandemics, and with a potential expansion of tropical climates due to the warming of the planet, you can get bigger areas that affect those, but also how the increasing frequency of disasters can influence public health as well. So yeah, definitely like to speak further on that as well.
I liked how you
It's
pointed
all
out how
depressing information. One example is the climate exacerbating Lyme disease and dozens of other tick-borne diseases. In the pandemic, we've sort of forgotten that we also have an epidemic that is spreading north as the freezing, the level where we get more than 10 days in a row of freezing weather is moving north. So that's really an environmentally directed disease issue.
Do you find that the strands of this corona pandemic, they are more moving north to the states, or are these not so directly correlated to that? Otherwise, the spread of the disease would be more in the north and not in the southern states.
which disease are you talking about?
I'm talking of our current pandemic, the COVID-19
The
pandemic.
COVID?
And COVID-19, does it correlate with northward movement of the weather? I mean, as the weather gets colder, do we see more spread in northern states than in southern? By any chance you have looked at that? Of course, it's
That's a good question for Ajay. The environmental and or seasonal effects on COVID are really questionable. And the massive information that's been collected during the pandemic has cast, as I understand, quite a lot of doubt on that. But
yeah, so far we haven't really seen a correlation of really a strong correlation between those factors, unfortunately. Well,
okay,
yeah.
I have, I see Ajay is on the chats, on the list of participants. If you want him to comment, he's welcome. But I have another related question. See, sometimes, yes, very dynamic, two things happen, but sometimes very localized things happen. For example, track of a tornado devastates the city. So at the time, do you have a filter possible on vulnerable population in that track of the tornado that is more likely to be more, more potential for spread of disease, those people have to be separately evacuated compared to the others.
Yeah, that's not something we have done yet, but is definitely within the capability of our current analysis. The only caveat to that is, again, it depends on where the tornado has occurred, what level of granularity that specific state or county has COVID-related information down to. Because if it's an entire county, it's not as helpful, but if you can get it down to specific census tracts, like, okay, we know, take these populations, isolate them, because we know it's these populations, not the surrounding ones, and stuff like that. But yes, that's definitely something capable within our analyses. And in addition to that, the health risk index we created previously before the pandemic is also useful in that case, because it helps identify, are there people are there elderly that might not be able to get out of their house if it's damaged or stuff like that, so they know what supplies they need to bring before they actually get there, so they can start really helping out the people on the ground.
Fantastic. Very good. Excellent. Thank you. What aspects of FGDC metadata do you use most in these OGC pilots? Josh?
Say that again, please.
What subsets or what types of metadata are most useful for your OGC pilots from FGDC metadata set?
That's a really interesting question, because for most practitioners, they just want to trust the indicators that they're being provided. For a subset of them, they do want to know where the data came from, and so the provenance of the data, more in terms of who it came from, rather than the specific parameters of quality, for example. And there is an interesting challenge represented by Stack. I don't know if you've heard about this, but this is a way of utilizing files in a cloud store by indexing ranges within those files, along with a small amount of FGDC metadata to help with identifying the correct data to retrieve from those object stores. But one of the reasons those are, I think, these Stack documents are being very successful is that they combine metadata and navigational information. So you have to use them to to access the data that you want. And for free, you get this metadata along with it. So there are cases of choosing the right data for one of these indicator recipes. There are cases, although it's very much a subset of users who want to drill back into the sources of the indicator. If the indicator is not, for example, jibing with their intuition about the situation. But for the most part, what we hope is that we can set up the environment for those that need to learn more about the data without either overwhelming either the publishers or the users of that data with that information. You're always combating the not misplaced impression that this is, useless information.
Josh, you brought very good point. I was only familiar with data active archives like what NASA has. I'm sure you are familiar with those, Goddard and other DACs. But this coupling in the cloud of the metadata along with the data sets allows you more dynamic accessibility on the web compared to the earlier where you had to go and search get the relevant data sets, and then order that imagery, that sort of sequence.
Yeah, it's more like a lower level tier. So files, these data files, index files, and then multiple providers can build services or catalogs or search engines on top of that same data. I think the main idea of this is that, you know, the actual publishing of the data should be as lightweight as possible, you know, leveraging those capabilities such as a object store, which are already there, and not restrict then how it can be used. You know, if we say, okay, this data is only available through a web coverage service, and then somebody else needs a thread service, and they can't get it because it's only available through the web coverage service. So that sort of multiplicity of access is becoming more and more of a value, I think, in these ecosystems.
So Josh, you mentioned in your briefing, and Paul may also have a comment on this, the hope of using schema.org. I wonder where things stand with that and what you expect out of that.
Excuse me while I take an antacid.
No worries,
know,
I can
we-
start off. No, you can go, Josh.
Yeah, so my reference to it has to do with the fact that Google and other search engines interpret structured data in a web page based on its references to schema.org, and, you know, the understanding of their code by their code of terms there. So it's kind of a necessary evil. Let's put it that way. Your take, Paul?
Yeah, I don't have too much experience with like JSON LD and stuff like that. I have some experience with ontologies, but yeah, I think schema.org is definitely a good starting point for doing these JSON LD kind of stuff. But as we go more into the specifics of health and pandemics and disasters, we might want to see about getting more appropriate tags, because for some of the data that we're producing, there isn't currently a really correctly applicable / descriptive tag on schema.org currently that properly describes what the data is. So we have to kind of fiddle with it and get it to a category that's close enough, that's being used widely to get that properly tagged.
Yeah, I think that's very much people's experience. One of the more prominent efforts to make schema.org into something more useful is the bioschema work. Of course, the biomedical area has more resources usually to do some of those things. So that's actually what people look at as bioschema. It shows it takes a lot of work to make this actually cover what you want it to cover. We had a recent session at Earth Science Information Partners January meeting, ESIPS meeting, in which there was discussion of Wikidata, adapting the vocabulary and information that's in Wikidata for use for things like drones, of course, which would be involved in observations on disasters too. So here and there seems to be an effort to try to make some of these things work, but it seems to take a fair amount of resources and effort.
I very glad. Paul, I would like you to kindly comment on the ontology aspects. If you develop these ontologies for these disasters, how dynamically would they have to change in order to satisfy needs of your pilots, at least?
Sure. So unfortunately, I wasn't one of the main ones to work on the actual JSON LD ontology for our work. That was mainly GeoSolutions, because we partnered with them for the GeoNode GeoServer spatial data infrastructure. I can only kind of reiterate my previous point is that it was hard to find a category or tag that properly fit, especially the medically related information and some of the supply chain related items as well, to properly categorize those data points. So you'd have to put in a bit more of a broader category than we really would have liked.
I see. Okay. Thank you.
It is interesting because the bio area is one of the areas where ontologies are the most developed. We have the most experience with. The other area is an environmental area of sciences, environment itself. There's the ENVO ontology, which applies to some aspects of disasters. It hasn't been focused particularly on that, but could be adapted.
I think as with many sorts of work efforts on tools for disaster response, they tend to need to be pretty lean and agile and focused. And so, you know, there is this view of ontologies that they're general specifications of reality. That's pretty hard to apply. What is effective, I think, are you know, means of, for example, classifying or aggregating, you know, nesting structures that let us define how to aggregate information. Well-known specifications of specific entities so that we can, you know, integrate information based on, you know, many different domains, many different languages and so on. But, you know, coming to that agreement on a concept means there are only very few critical concepts that really can play that role. So there are these very, I think, very focused applications for ontologies and ontology elements, but the efforts at, you know, sort of grander biological ontologies or even ontologies of disaster paradigms, let's say, have not been that useful because there's so many different practices to try to harmonize.
I mentioned our planned speaker was Shirley, and she actually has worked on trying to take existing vocabularies, Shirley Ambrose, I should say, from existing vocabularies from the UN and actually build an ontology, a series of modules, ontologies that actually can be used for disasters. I hope she'll be able to actually present in the future. You guys might tune in and have some comments on that and maybe find some use for it. It is part of an NSF-funded effort, which is particularly using linked data to build a sort of a knowledge graph to be able to answer questions about disasters and pilot on a few areas of disasters, one of which is flooding. So again, I hope she can present so you have an opportunity to hear an approach to this.
That would be great. You know, I will mention that, you know, there is currently a Geosparkle standards working group working to update the Geosparkle standard. And Geosparkle standard, you know, version 1 was focused very much on Sparkle and on OWL. The new work is trying to expand a bit to support graph information more effectively and not essentially be limited to OWL RDF. And so we'll see how that comes along. But one of the purposes of that is that many of the best applications don't or can't involve reasoning anyways. And there are just more tools that will run on some of these graph structures than really leverage the capabilities of something like OWL. So at work to apply some of these developed ontological schemes having to do with disasters, if they focus on, you know, that development and maintenance of a graph to integrate information would be great.
Our board chair, Ken Baklowski has a KGSQL. So that if it is combined with something like Geosparkle, can probably give you some reasoning capabilities and search capabilities. So that is something, Josh, you may want to keep in mind. There are a couple of questions on the chat. One of them refers to either Darwin core metadata or Dublin core. And any comments on that? And there are a couple more questions. One is from Todd for meaning of disaster. Yes, please. Someone was speaking, please go ahead.
Yes, I'm sorry. I've made an error. It's a Dublin core standard, and it's a meta standard like schema that is used more or less like schema.org, and that's why I'm asking if you have some research, or if you are using it also, why you don't, because you didn't mention for the Dublin core standard. And the Dublin core standard is actually using in different domains, not only probably not only in the disasters, but I have found it that it was used in other domains, very in agronomy and in biology a lot also. So that's why I asked that question. I'm asking.
I guess they have, probably the speakers in the pilot have not worked on the Dublin core or the Darwin core metadata.
Well, not Darwin core, which has to do with biology, but they're actually, so the component provided by GeoSolutions and operated by HSR, GeoNode, incorporates a GeoNetwork catalog, which does need to run on metadata. Of course, it's a CSW compliant catalog, so it uses the OGC core, but OGC core, is largely overlapping Dublin core,
Sure.
GeoDCAT, and 19115. So that there is a general core of terms that are used in all those places, and the discovery of information is really important in this data ecosystem that we've tried to develop. But beyond those, general terms, there is the problems associated with determining whether data is ready for a particular analysis. And so those do require some either extended metadata parameters or conformance with one of the specifications for analysis ready data that define what those values should be anyways.
You have a comment on this issue about using something like schema.org or Dublin core for vocabularies versus OWL, where you get more into the possibility of some form of logical reasoning. And the lighter approach actually can help at least support some type of interoperability, which becomes because people are using similar terms and they have very modest relations around them, and that's enough for a lot. So it really is a good step. Of course, those people who are really looking farther along in terms of richer semantics, there's a place for that down the road. But at least achieving some degree of interoperability and understanding, some commonality, is a valuable thing with this type of data. You can put different data sets together.
Well, I would like to request if anyone else who has not spoken would like to raise a question or a comment. And also, my last question to the speakers is, where do you see the next pilot going? And when will you think that these pilots would lead to some operational impact? First, anyone else, please.
Well, we have thought about this. So these are some of the ideas that we're going to pursue for the this year's disaster pilot. So looking at other hazard types, looking at particularly climate-related hazard types, more fully develop this service architecture. You know, we was kind of testing with various experiments and some degree of integration really led by Paul and the smaller group of the participants, but there's a lot more that really needs to be done. And part of what we did was to foster, with Mark Reichert's help, a stakeholders group. So we had this really worked out a list of personas who need to interact with this ecosystem to derive benefit. And we tried to connect with organizations representing those stakeholders and hold a monthly meeting, for example, with them. And along the way, we rediscovered how difficult it is to connect these innovation activities with practitioners, especially first responders. They are just, too busy and focused to engage in research. So we're really looking towards both operational exercise support and training support in order to, build capacity and transfer knowledge from these activities. Those are really difficult, quite expensive in terms of, the wrangling of organizations and people that are involved. So you really have to choose carefully what it is that you want to bring to operational status, but that is definitely, in the future of these activities.
Fantastic. That is that is what we were looking for.
I like Paul's comment in the chat in terms of they actually are helping in some areas.
Yes.
Applied.
Yes, I like the fact that actual agencies like FEMA and WHO are involved, but on the local level, do you also have emergency management related services people who normally run, let's say, services of ambulances or things of that sort as part of stakeholders?
From HSR.Health's perspective, we have worked with Maryland's emergency management organization, as well as with Florida, specifically early in the pandemic when we were looking at the distribution of ventilators for COVID patients. So we have had, HSR.Health has had interactions with local emergency management as well.
Oh, thank you for that slide. That's very expressive. Thank you. I hope that these slides would be available to us to put on our website, because it will bring video recordings, it will bring great value to our essentially for starting session.
Or maybe just a link to it that Josh has.
Yeah.
Yeah, I provided you a link to a more succinct version of this slideshow that was presented to the Canadian Council on Geomatics. So, but I note here, Alan Leidner and Gizmo, as well as NISJIC and New York State GIS have been stakeholders and participants in the pilot. So we've benefited from a more of a municipal perspective in looking at some of the possible impacts.
It takes a village.
So Gary, do you want me to thank, or would you please kindly proceed to
Well,
thank?
I certainly want to thank our panelists here,
Yes.
Paul, Josh, and Ajay, for filling in very nicely. This is really a good start for us.
Yeah.
So I want to thank you again under these difficult circumstances, time pressure, and I hope you'll be able to come by for other of our sessions and participate that way too. I think we should, in closing, say a word about next week's session too, right?
Yes, yes. I would like to just quickly introduce you to the topic of more general interest rather than disasters is the inherent infrastructure capability for ontology development. And everyone knows probably the name of Psych or Psychor, which is also known, among other things, for its micro theories. And people like John Soa have talked at length about it. But now the founder and CEO of Psych is going to speak to us next week on Wednesday at noon. And Doug Lennett would be our next speaker. And I request those who have general interest in ontologies also to join, in addition to our theme of pandemics. They will also talk, there he will also talk about supply chain and hospital applications relating to Psych applications capabilities, as well as general architecture about Psychor. I also want to take this opportunity to thank the participants who've been patiently hearing and enjoying the presentation. Can I hand over the meeting to you if we are okay, Gary? Please.
Certainly.
Okay, so I guess it's time to adjourn. Once again, thanks to everyone. This was a really exciting session. I want to thank Ravi for mentioning KGSQL. I don't know that that's particularly relevant in this context, as it's really just something of an extension of Sparkle to get more capabilities out of knowledge graphs.
Yeah, but if they,
it's also very important, as they said, until you have tooling, it's hard to make use of these ideas, even if you can say they're good ideas. Without the tools and general acceptance, it's difficult to use them, say, in an emergency context.
So when OGC has a pilot on the use of knowledge graphs, your new standard could be applied there again, so you can become one of the participants.
Yeah, I guess I could. So anyway, thanks to everyone. Wonderful meeting. And then I guess we'll adjourn now. Hope to see
Thank you,
everyone next
everyone.
week.
Help get the word
Take
out.
care, everyone.
thank you.
Here.